I'm a doctor and I'll never take these 5 medications. Listen, I need to be very careful with what I'm about to tell you. This video might ruffle some feathers, but someone needs to say it. I've been in healthcare for years, and there are certain medications that I would absolutely refuse to take myself unless my life literally depended on it, and I'm going to explain exactly why. Now, before the comment section explodes, I'm not telling you to stop taking your medications. I'm not your doctor. But what I am going to do is give you the information that pharmaceutical companies don't want you to have, so you can have an informed conversation with your doctor. These are medications that millions of people take every single day, thinking they're helping when in reality, they could be doing more harm than good. And the worst part? There are often better, safer alternatives that nobody talks about. So let's get into it. Here are the 5 medications I would never take, and what you should know about each one. Number 1. Proton Pump Inhibitors, or PPIs. These are drugs like Omeprazole, Prilosec, Nexium, and Prevacid. They're prescribed for acid reflux, heartburn, and GERD. And they're everywhere. In fact, they're some of the most commonly prescribed medications in the world. Here's how they work. They basically shut down the acid-producing pumps in your stomach. Sounds great if you have heartburn, right? The problem is this. Your stomach produces acid for a reason. Stomach acid isn't your enemy. It's actually critical for digesting food, absorbing nutrients like B12, calcium, magnesium, and iron, and it's your first line of defense against bacteria and parasites that enter through your mouth. When you suppress that acid long-term, here's what happens. First, you increase your risk of bone fractures because you can't absorb calcium properly. Studies have shown a 25 to 50% increased risk of hip fractures in people who take PPIs long-term. Second, you become deficient in B12, which can lead to nerve damage, memory problems, and fatigue. Third, you're more susceptible to infections like C. difficile and pneumonia because your stomach can't kill off harmful bacteria anymore. And fourth, and this is the kicker, you increase your risk of dementia. Multiple studies have linked long-term PPI use to cognitive decline and Alzheimer's disease. But here's what makes me angry. Most people are put on these medications and never taken off. They're supposed to be used for 2 to 4 weeks maximum, but I see patients who've been on them for years. So what should you do instead? Address the root cause of your reflux. Often, it's not too much stomach acid, it's too little, or it's a hiatal hernia, or food sensitivities, or being overweight. Lifestyle changes like losing weight, avoiding trigger foods, not eating 3 hours before bed, and elevating the head of your bed can work wonders. If you need something for symptom relief, talk to your doctor about H2 blockers like famotidine, which are much safer for long-term use. Or natural options like DGL licorice, slippery elm, or aloe vera juice. Bottom line, I would never take a PPI long-term, and if you're on one, you need to have a serious conversation with your doctor about getting off it safely. Number 2. Benzodiazepines. These are anti-anxiety medications like Xanax, Valium, Ativan, and Klonopin. And they're terrifying. Look, I get it. Anxiety is real. Panic attacks are debilitating. And these drugs work. They work really well. That's the problem. Benzodiazepines work by enhancing the effect of a neurotransmitter called GABA in your brain, which calms down your nervous system. And within 30 minutes of taking one, your anxiety melts away. Sounds perfect, right? But here's what they don't tell you. First, they're incredibly addictive. Your brain adapts to them within weeks, sometimes days. And once you're dependent, getting off them is absolute hell. Withdrawal from benzodiazepines is one of the most dangerous drug withdrawals that exists. It can literally cause seizures and kill you. Second, they destroy your memory and cognition. Studies show that long-term benzodiazepine use is associated with dementia. These drugs literally shrink parts of your brain. Third, they increase your risk of falls and fractures, especially in older adults. These medications affect your balance and coordination, and that can be deadly. And fourth, they stop working. Your body develops tolerance, so you need higher and higher doses to get the same effect. And then you're trapped. I've seen patients whose lives have been ruined by benzodiazepines. People who started taking them for short-term anxiety and ended up dependent for years, unable to function without them, but unable to function well with them either. So what's the alternative? For acute anxiety, there are other options like hydroxyzine or buspirone that aren't addictive. For long-term anxiety management, therapy, specifically cognitive behavioral therapy, has been shown to be more effective than medication without any of the risks. Other options include regular exercise, which is proven to reduce anxiety, meditation and breath work, magnesium supplementation, and addressing underlying issues like thyroid problems or blood sugar imbalances that can cause anxiety symptoms. If you're currently on a benzodiazepine, do not stop cold turkey. That can be dangerous. Work with your doctor on a slow, gradual taper. But I would never start taking one of these medications knowing what I know. The short-term relief isn't worth the long-term consequences.